Hi there, this is my first vlog, and in this vlog we're going to be looking at the squat and the overhead press. I've used three athletes, all of whom are US Air Force band members, because I've only just moved to San Antonio with my wife and I don't actually have my own client base as of yet. One of the athletes was used for both of the capacity issues, and two individual athletes were used for the skill issues. Here we can see our first athlete who has a skill issue. And what we can see as he squats down is that he has a lateral shift to the left, which is being highlighted now by the arrow, and the box that he's sitting into as he's sitting slightly to the left of it. It's further evidence, as you can see, more of his right knee than his left knee as he drops down into the bottom of the squat. The athlete had mentioned pain around the MCL, so we worked on the adductors on the foam roller and managed to eradicate that pain. So the first intervention that we did was a hip disassociation exercise with one foot on the wall and one off, trying to get the right side to move independently of the left and the left to move independently of the right. We then worked on external rotator exercises, and we started with the clam in side lying with the knees bent to try and get the athlete to understand the role that the external rotators would have. And then we moved him into a standing external rotation exercise, working with the mini band just above the knee. And as you can see, he's sitting down much straighter now with more cues to stiffen up his trunk. And as you can see, he's sitting down into that box, and you can see his left and right knee are coming out much more equally, although the left knee is still not getting out quite as far as the right. The banded distraction in this video was to aid in the stabilization of the trunk against an external force that's trying to actively move the athlete further into that lateral shift. As you can see, as he goes down, he does a lot better trying to keep his body square, a much more upright torso, and his eyes are also looking slightly above him. This final comparison of the pre and the post squats shows quite clearly how the exercises and the interventions that we've done have affected his skill. He's now squatting down much straighter. He's got a much wider stance to help with stability. His knees are pushing out further, and he's got a stronger grip on the bar, although we could open his left arm up a little bit more to make him a little bit more symmetrical to the right. In the next athlete, we find our capacity issue, which appears to be driven by a lack of thoracic mobility and tightness throughout the hips, which was noted during testing regarding internal and external rotation through passive range of motion. We can see that the athlete has significant tucking from around 75 degrees of knee flexion. We can also see that the ankles are rolling inwards when the tucking becomes most prominent. Further, there's T-spine mobility, which is evidenced by the rearwards position of the elbows, which is forcing the athlete to lean forwards, and their forward gaze, which is also causing them to lean further forwards as well. But it's the immobility of the hips and the thoracic immobility that is most prominent here. To further assess the degree of tucking, we put a strip of tape along the athlete's back to see when increased tension caused it to pull off. And as you can see, although the light is poor, it's pulled off at around 75 degrees again. To increase thoracic mobility, foam rolling of the thoracic spine followed by thoracic extensions over the roller were carried out, along with the quadruped thoracic openers, as you can see in the bottom clip. Hip mobility drills were also carried out and were assessed pre and post, leading to an 8-degree overall improvement for internal and external rotation on the left side, and 11 degrees internal and external on the right hand side. We also carried out a neuromuscular drill to encourage firing of the external rotators by the use of the mini band and by forcing the load to be kept ahead of the body. This forced the athlete to keep an upright posture, leading to a better spinal position and tucking occurring 15 degrees lower than the previous loading strategy. Further, we can see that the feet are staying flat on the floor. In this final comparison with the pre on the bottom and the post on the top, we can see that the athlete is able to achieve a greater degree of flexion without compromising his spine. We can also see that the feet are staying flat on the floor, Although we can't see the gaze, he is looking straight forwards as well. In our skills overhead press video, we can see that the athlete's starting out with the bar in his fingers, whereas we would like to see it in line with the forearm, as is being highlighted now. Further, as he goes to overhead press, we are not seeing any retraction of the chin backwards to get the head out of the way. Instead, the bar is having to travel in front of the body. As the athlete reaches the overhead position, we can see excessive anterior rotation of the hips, excessive lordosis in the spine, and a slight rib flare at the front. To ensure that these were not capacity issues, I had a look at the athlete's thoracic mobility and found that there were no problems there, and decided to have a look at the press as he had no top on, so that we could see the movement of the scapula. And as we can see, the left shoulder is slightly higher than the right, but as he goes into the overhead position, you see quite an even movement of the scapula to around 50-55 degrees. Further, the head is kept in neutral throughout the whole press. After working with the athlete on keeping the bar in line with the forearms, retraction of the head as he goes over into the overhead press, and better trunk stability, we can find that he has a more neutral pelvis and a reduced lordosis. In our capacities overhead press video, we had the same athlete as from before. As he starts off the press, you can see his anterior rotation at the pelvis, excessive lordosis, and again he doesn't have the bar in line with the forearms. Further, as he goes overhead, we can see evidence of thoracic immobility due to the arms being pushed forwards and that excessive lumbar extension. Seated thoracic extension showed a reduced range of motion, so along with the foam rolling and the thoracic extension performed for the squat, we also worked on the lats, T-extension, seated wall slides and activation drills including band pull-aparts. The wall slides improved by 3 inches, though limitation on the left-hand side was greater than that on the right-hand side. The next 2 drills were more neuromuscular in nature and were intended to increase the athlete's stability. The banded distraction was used to work on trunk stability, with cues focusing on activation of the right glute and for the athlete to maintain abdominal pressure to reduce rib flare. The final exercise further reduced stability by having the athlete on both knees and was used as a drill to ensure that he was able to activate his glutes and abdominals at the same time whilst going overhead. In the final comparison, we can see that the start position is improved with a more neutral hip position, which is reducing the lordosis that we can see in the top pre-intervention video. As we go into the press, we can see a more direct line from the barbell through the athlete due to a better shoulder position. Further, the athlete does not have to rely on lumbar extension to get the shoulder girdle into the overhead position. Having only had the athletes for a short period of time, the changes in the skills and capacity-driven issues have not been fully rectified, as was clear in the videos. However, there were significant improvements in all of the athletes. Given more time, I would have continued with the interventions that we were utilising, and I believe that within a few months, the athletes' performances within the weight room would have been improved, due mostly to a greater understanding of the way in which the movement should be carried out. With regards to the capacity issues, I would not let the athlete perform the loaded movements straight away, such as the squat and the overhead press, until there were significant improvements in the range of motion, and I would therefore regress the exercises along with the mobility issues. I would have them practice the regressions and the mobility issues for a significant period of time. Regarding the skill issue, I would spend more time on the exercises with a light load, especially with the squat, which I would start every session with a neurological patterning exercise and no load therefore, and gradually increase the load and the intensity of the exercise as time goes by.